Death is inevitable. It can happen anytime, anywhere, but when it's chosen due to a terminal illness, it impacts a lot of relationships. One in particular being my friend's, who is, his father-in-law is currently diagnosed with lung cancer, and he has decided to stop treatment altogether. Giving him no longer than a year to live because of this choice. Which brings me to my topic, which is active physician-assisted suicide. My main claim of fact is that this accepted use of active physician-assisted suicide undermines the patient-physician relationship. For those of you that don't know what physician-assisted suicide entails, it is described by Merriam-Webster as suicide by a patient facilitated by means or information such as a drug prescribed by the physician or a lethal dosage provided by a physician who is aware of how the patient intends to use such means of information. I will be doing this by providing 3 premises to support this claim. The first being that physician-assisted suicide causes harm to a doctor's Hippocratic oath. The second premise is that physician-assisted suicide is encouraged by the government and insurance companies instead of a traditional medicine method. And my third premise is that physician-assisted suicide is a disregard for human life. Now let's go back to my first premise, which is that physician-assisted suicide causes harm to the doctor's Hippocratic oath. Every doctor is sworn in with this oath, and I want you guys to pay attention to two specific statements that allowing physician-assisted suicide to continue will go against, which is that they first promise to do no harm, and also that they will neither give a deadly drug to anybody who asks for it, nor will they make a suggestion to this effect. If physician-assisted suicide is accepted, then that means that the Hippocratic oath that a doctor takes is invalid. That assisting patients with death would not only be doing them harm, but would also do harm to their families as well, which could in turn weaken the physician's very foundation of practicing medicine. And Diane Meir, who is a doctor and a professor at the Palliative Care Ink School of Medicine, says that the use of sedation is a refractory symptoms in patients near death may have led physicians to report actions intended to relieve suffering, not necessarily meaning that a lethal dosage is necessary in order for a patient to continue to for a patient to survive. It's just that they need to be sedated enough where they can't feel the pain, and that the doctors need to do what they can to help this patient live instead of die. My second premise, which brings me to my second premise, which is physician-assisted suicide is encouraged by the government and insurance companies instead of traditional medicine methods. One example that I'm going to use is in Oregon, where it is supported, and where some patients have been told by their health insurance providers that a costly drug prescribed by a doctor to treat the patient's illness would not be covered, but inexpensive lethal drugs for assisted suicide would be, which is promoting that they won't support them trying to get better, but instead they would want them to accept this lethal dosage to not only avoid pain, but also to lower the cost in hospital stays or medication that they would need in order to live out their duration of their life. And these drugs can go from $75 to $100 to be administered, and this is based off of the physician-assisted suicide website, and which could help the government in cutbacks when it comes to healthcare, as well as those that don't have healthcare and that are terminally ill. And this would help the government tremendously when it comes to not having to house patients that are terminally ill and are not expected to survive. Which brings me to my third premise, which is that physician-assisted suicide is a disregard for human life. In our society, when someone dies, there's usually a 1 to 2 day ceremony that celebrates their life, that has people know that, they were an important asset to society. However, if we let physician-assisted suicide continue, then it's not only going to hurt the relationship for the physician and the patient, but it's also going to hurt the relationship that people have with their families as well, as can be seen in, and it doesn't really matter if they knew them or not. I think that it's still important that living and having a life is important for us to acknowledge, as it can be seen in the 9/11 attacks. For example, people who didn't know the victims personally mourned and donated funds to the victim's family, prayed, and still remember them today as the annual anniversary comes up every year. I believe that ending a life due to medical costs it means an individual life, and those without access to funds will often consider this method because they feel that it would be a burden on their family if they didn't. And that a lot of research isn't done for the patient when it comes to terminally ill patients if they want this to occur. Because a study was done by, by Ezekiel Emanuel, who was a professor at the University of Pennsylvania. And it was a study done in 1996 to 1997 of 928 patients. Out of these 990 patients, there was only 256 who were certain of it, but only one person actually went with physician-assisted suicide. And so this demonstrates that many people who say that they want physician suicide are just doing it because they were dealing with depression, not necessarily because they were in pain. Because pain can always be treated by such forms of sedation, and I feel that, which brings me to my claim that if the accepted use of physician-assisted suicide continues, that this will damage not only the families that are involved, but also the physician and the patient relationship. Thank you.
All right, Christine, the proposition's clearly identified. There's a good layout of what the supporting points are going to be. There's plenty of controversy on this. You signpost the first point when you get to it. I think you need a little bit more background on the patient-physician relationship and what's important about it. Although the truth of the matter is that most of your supporting points don't really talk about that issue. They talk about some harm occurring if we allow physician-assisted suicide, but it doesn't seem like it's primarily about the relationship. The only part that is directly connected to that is the first point, and the patient never becomes a part of that process on that first point. It's just talking about how it's going to change or make a section of the Hippocratic Oath irrelevant. And I think that that might be true, but why is that important to the doctor-patient relationship? You need to talk about the trust that patients put in the doctors. They know that they've been able to put that trust in because they are sworn, for instance, not to do any harm. And if they're not going to be swearing to that anymore, then the premise of their security is undermined. That's the way that argument needs to be developed. On the second point, there was a very clear transition. I'm not exactly sure that all the information you presented on that was cited properly. You mentioned a cost issue, for instance, that's going on, and you talked about a case in Oregon, but I didn't get a source citation on that. It sounded like a summary rather than a direct quote. If it is a quote, you definitely need to make sure that you cite it. And even if it's something that you would describe as being a fact, we have to know where it came from because, like I said, in the way it's presented, it's taken as a premise, and it certainly sounds like it's a controversial premise. There are a couple of points on the other issue, on the third issue, that are a little bit confusing. I don't know exactly what the 9/11 comparison gets you, and that last study that you cite seems to be talking about whether or not we need physician-assisted suicide, which is a different issue than whether or not having it would cause some particular problem. All right, thank you.